Hey YouTube family, what's going on? I'm Matthew Tonthat. I'm a urologist, and I'm here to talk about our medicine's approach to men's health, which is terribly insufficient. It's not covering. It doesn't do the job. But when you think of men's health, you think of, I guess, blood tests, because if let's say, as a physician, as a urologist, what would make up a men's health like checkup? That would include like vital signs, physical exam, uh, blood tests, which would be like a complete metabolic panel, which is like kidney function, liver function, electrolytes. It would include testosterone. It would include a prostate-specific antigen, which is prostate cancer screening. It would include a lipid profile, which is like your cholesterol, your triglycerides, and maybe some sexually transmitted infection testing. And you get the results, and if they're normal, you get 2 thumbs up, and I'll see you in a year. If they are not normal, typically you end up with, as the patient, you end up with a new medication or more than one, or a referral to another provider, or more blood tests, or an imaging study, or a procedure, or a biopsy, or a surgery. And already we've stepped away from what I see men's health as, which is the like physical, mental, and social well-being of men, that is specific and unique to men, or like the health needs that are different from those of women. And we've already like really stepped away from that, especially when you look at what is most important to the health of men today. And I don't think it's testosterone levels. But you don't blame medicine. You cannot blame healthcare or medicine. I love doing it, but I even then I feel like I can't, because that's all that the institution, that we know how to do as doctors. All I know how to do is order blood tests, do a physical exam, order imaging studies, place referrals, look at the numbers, look at the trends, read research papers, read guidelines, and it goes further and further away from what men's health is on the kind of like more foundationally. And you can't blame medicine, because medicine is not about health, even though it's healthcare. When I think about health, I think about healing. When I think about healing, I think about you feel better. When I think about what I do as a urologist, and what many physicians and surgeons do, is we are not healers per se. I mean, there are things that we do that help people, but it's not in a healing fashion. It's more of in a treating fashion, or a removing fashion, like a surgery to remove a tumor or to remove a kidney. The way I like to think about the way we approach health from medicine, the standpoint of medicine, is like kind of like the military. You know, show us the bad guy, we'll cut them out, we'll radiate them, we'll destroy them with chemotherapy. We'll take care of them. But it's not a very healing process. It's more of a destructive one. And there is a time for that, like in trauma, for instance, or like, acute issues, like for instance in urology, like a ureteral stone, a stone blocking the kidney. That can be, very like relatively easily addressed with modern surgery. You place a stent, and then the kidney is draining. The stent's a tube that goes between the kidney and the bladder. And so there's a function for our healthcare, but it's not men's health in the way that I think most of us would see men's health. So what you got to do is to, and what I want to do is to empower you. Like, you already have your health. You have it. Your health is whatever you need to do right now that's healthy for you. That's your health right there. Like, seeing me once a year and having me do a few blood tests and examine you is not that. So go do that thing. Go do what you need to do to be healthy, and I'll do the same. It's bedtime. It's time for me to go to bed. So I'm gonna do my wind down routine. I'm gonna minimize my screen time, and I'm going to go to sleep early. All right. That's all I got. Good night and be well.